My name is Ali McBride. I am a pharmacist. I am the clinical coordinator for pharmacy for the University of Arizona Cancer Center. We had devised a means to give chemotherapy, traditionally in the inpatient setting, in the outpatient setting. And by doing that, we improved access to care for our patients and also decreased the total cost of care to our institution.
At the University of Arizona Cancer Center, our mission is to prevent and cure cancer. And we would like to be able to cure cancer in a way that's easiest, most convenient to the patient. So this speaks to that part of our mission. By moving a lot of the cancer treatments from hospital-based to clinic-based, we're able to improve patient experience, reduce risk of infections, and improve quality of life for the patients.
So we work with our physician team, we work with our finance team and also our nurses to address what chemotherapy we can move to the outpatient setting and also what other issues need to be amended. So that means supportive care therapies, looking at take-home prescriptions and also monitoring.
To accomplish anything in medicine, it takes a team because we have different types of professionals looking at things from different angles with different expertise. So as you know, any kind of multidisciplinary team is about consensus, about having buy-in from different parties. Patients often need to stay a long time in the hospital, which is a major issue for quality of life. And it's also an issue of safety for the patients because during the year of COVID-19 pandemic, that means there's a greater chance that they may get exposed to the virus, along with other illnesses that unfortunately are more common in the hospital.
With the idea of actually moving those patients outpatient, that decreases their risk, right? We've reduced the risk, especially for admitting inpatient or patients to the inpatient setting with COVID. And by actually moving those chemotherapies outpatient, they were able to actually sleep at home at night. They were actually able to take care of their family or be with their family, but they don't have to be tied to a pole or a line with fluid. So based on the chemotherapy that we transitioned to the outpatient setting, that was normally in the inpatient-based infusion, we'd actually really promoted their activities of daily living. And that in itself is priceless.
I think it's important to realize the value of clinical pharmacists in our teams. Clinical pharmacists are becoming more and more important because we have so many drugs and so many new drugs that we use in the fight against cancer now.
Innovation is not one person, it's not one entity. It's really the whole healthcare team. At the University of Arizona Cancer Center and also at the University Medical Center Tucson, what we have seen is the evolution of this process of care. Right? In these cases, we've transitioned that care to the outpatient setting, and what it has done is it's maximized the reflection on what we are doing to innovate care delivery for the cancer patient, and that's what we've done here. In as such, it's allowed other institutions across the country to replicate that process to improve patient care, which is exactly what we want to do, improve patient care in the oncology setting.